To discuss Nigeria's healthcare challenge and the recommendations in this report, we are now being joined by Professor Ibrahim Abubakar. He is a health expert and lead researcher of the Lancet Nigeria Commission. Very warm welcome to Newsnight.
Thank you for having me.
Your report is not cheery at all in all material particulars. First is talking about universal health coverage. Do Nigerians really enjoy it? When you look at the indices you've painted, first is the issue of kids dying under 5 years, dying in Nigeria more than anywhere in the world. How do we talk about universal health suffrage in this situation?
Right. So you cannot start fixing a problem except you recognize that there are problems.
Absolutely.
And we think that our report purposely sets out the challenges. But we don't stop there. We present the report as a pragmatic yet optimistic view of the future, because we go through and we reflect on detailed recommendations that we believe, if adequately implemented, would make the difference to the challenge you just articulated, i.e. preventing needless deaths among kids, as well as pregnant women who die and can be prevented from dying.
Right, and Prof, let's look at the fact that, looking at the projections, Nigeria is estimated by 2050 to become the third most populous country in the world. Despite the fact that this population, a lot of other countries will say it's to our advantage. But unfortunately, looking at all the indices as it concerns health, it is not to our advantage, really. And it's not the first time we're seeing recommendations by organizations or even the United Nations and even the World Health Organization. But at the end of the day, after the papers are released, what else is done to ensure that all of these negative reports that we get concerning especially women and children dying is changed? What do you intend to do differently this time?
Right. So you are referring to the so-called demographic dividend, and a demographic dividend can only be gained if we get the population healthy. So what's different about our report is that we brought together some of the top Nigerian experts from within the country, Nsukka, Ibadan, Kano, as well as the diaspora. We took a step back, and over 2 years, we distilled the issues that stop implementation. So why is it that if we compare ourselves to other countries, we don't do well? Are there case studies within the country, examples of success, whether at the local or state level? Are there examples of success in neighboring countries? And can we learn from that to unplug issues around the governance of healthcare and accountability, issues around how we deliver and implement information collection systems so we can get accountability from our healthcare providers and government, issues around how we train and support our healthcare workers, ensure they're adequately remunerated and they have sufficient career structures to remain in the system and deliver. So all the facets of the health system, we have specific recommendations supported by evidence, i.e. case studies that show how others have done them within the country and without. There is a vast amount of failure across the country that you can cite, but there is also good examples of success, which you summarize in the report.
Well, the successes that you're talking, are not so obvious or evident when you look at the nature of Nigeria's primary health care. At a time in this country, it was the focus of health development, because they feel that primary health should be looked at away from tertiary health. Not because tertiary isn't important, but the bulk of the population are in the rural areas. And primary health, of course, will affect children and women more. Has Nigeria been able to, set its target to achieve the goal of the African Union percentage, spending on health? I think it's about 15%.
15% was the agreement. Signed in Abuja here, actually.
Declared here in Abuja.
Yes, it was declared in Abuja.
In 1991.
So our report reflects on that. We think we need to do two things around financing. We need to spend the money that is allocated now more prudently and more efficiently through innovations such as strategic purchasing and getting better value for money. But we're absolutely not spending enough, especially on primary health care, where the majority of our populace get access to their care. But there are, within primary care, things we've done and we've done right. The establishment of the Basic Healthcare Fund is a good starting point to doing this right. Together with the initiation of health insurance at the state level and at the federal level, we think there's an opportunity to expand on that to ensure that the 83 million least wealthy Nigerians are able to get that basic minimum care to cover and provide free health care to kids, pregnant women, and all citizens. And there is a path to do that because others have done so.
Right. Well, Professor, you are, an expert when it comes to infectious disease, especially looking at epidemiology, and you are of the University College in London, and you're director of UCL Institute of Global Health. At the end of the day, we've seen the COVID pandemic really expose the loopholes in our health systems in Nigeria, despite the fact that all of the predictions as to how bad it will be did not come to pass, but we've seen those loopholes. So moving forward, what should Nigeria be doing, not just at the part of the government right now, just Nigeria as a nation doing moving forward, so we can see an end to the under 5 deaths and even maternal mortality and every other deaths that are avoidable, really?
So I would say there are specific lessons we've learned from the COVID-19 pandemic, and there are examples of things that we've done absolutely right. And that's why the brunt of the burden of COVID-19 was less severe as it could have been. It could have been a lot worse. The country responded promptly. The country organized the private sector to be able to contribute to the response appropriately. But ultimately, I think for me, the biggest lesson is that prevention is really important, and prevention is multi-sectoral. That's why one of our recommendations is that health should be in all sectors. So for example, if you think about the likelihood that someone would die of COVID-19, being obese, having diabetes would increase your risk. So if you have a healthier population, they're less likely to die from COVID-19. Therefore, prevention is indeed cure.
Good place to leave that conversation,
yes,
really.
Absolutely.
Professor Ibrahim Abubakar, a health expert, and of course the lead researcher at the Lancet Nigeria Commission, which was just launched a couple of days ago with that report damning, but although gave recommendations as how we can get better, really.
Yep.